My name is Jocelyn Hines. I am a family medicine physician. I've been a family medicine physician for, over 20 years. I am from Maryland, did all my training in Maryland. After I finished my family medicine residency, I spent a couple of years traveling around the United States, working with different primarily underserved communities at some federally qualified health centers, with Indian Health Service, with the Veterans Administration, did some international work on mission trips and things like that before I settled down at a federally qualified health center in Baltimore City, and spent quite a few years there, really doing fundamental primary care, developing relationships with patients and their families, and the things that are kind of the classic words that you say about your family medicine doctor, right? Part of the community and building social programs and those types of things. And then when that clinic closed, I moved on to the emergency room right down the street in Baltimore City, and saw firsthand what happens when people don't have access to good primary care services. And I saw a lot of my same patients who used to be well controlled with their diabetes or their liver disease or their COPD start coming into the ER and gradually go downhill. And that is what then inspired me to get my MBA in healthcare management. And so I figured I need to understand the business of medicine, because that's how you actually move the needle, right? Like the moral reasonings and, we should do this because it's the right thing. That can still be true, but I needed to figure out how to say it. We can do the right thing, and here's how we can make money doing the right thing. That's just the reality of the situation. So that's what I did. Worked in the ER, was in school, also had another job doing exams for disabled veterans, and then also in the same process ended up having 2 kids. So I was a very busy, person who was not getting a lot of sleep for a few years. And then I ended up moving to, after I finished that program, I ended up moving to a company that did healthcare analytics. Life comes full circle. So one of the things that I used to do years ago before was I used to do home health visits. And then, so when I joined the analytics company, what was I overseeing? Well, their home health visit program. So I got to see it from both the perspective of, I know what it's like to be the clinician in those scenarios, and then I also got to see what are we doing with all the information that we're gathering during clinical visits. I think maybe when I first started, we had maybe around 800 or 600 advanced practitioners, so combination of nurse practitioners and PAs. But when I left, I think we had over 1,600 that were across the continental United States for sure. I also started literally right before COVID. I was doing, not just me, but leading the tracking of COVID things and the COVID prevalences and trends in all the states that we were in, and then having to come up with compassionate policies based on the information that we're finding. For those of you who remember COVID, different areas had different social norms and different rules and expectations, trying to be in line with all of those things while still coming up with a company-wide policy, acknowledging individual fears, misinformation. Healthcare people are not a monolith, as I'm sure you can see on any, TV, social media, in any, the interaction that you had with the one doctor when you came last month and the different provider that you're seeing today. They have different opinions. There was not uniform agreement about vaccinations, about what steps were necessary. So I learned a lot very quickly on strategy, policy, communication with, internal staff. And like I said, because I understood what the job was, I was very mindful about the situations I was asking people to go into. So I decided to say yes to joining the house call team because for several reasons. One, but once again, prior experiences, right? You're a combination of all the things that have happened in your life. So it was so adjacent to having providers go into homes to facilitate, health visits. Well, that's very familiar, right? One, because I've done it, and two, because I've overseen it. But I will also say that my father had dementia, he's since passed. When I think about the different ways that I wish we could have had some on-demand kind of help, whether it was to check on him when he was still living, we were still trying to keep him in his home. My sister and I, we both had little kids at the time, were shuttling our, 1-year-olds to 3-year-olds, back and forth at 9 and 10 o'clock at night to make sure that my dad had, eaten and putting his pajamas on and, those types of things. The kids are upset. I'm tired. He's cranky. All of those things. It would have been nice to have some additional, eyes and ears to make some of those transition points smoother. So I appreciated very acutely what having in-home, being able to call someone and say, hey, can you, look in on or check on, or he was seeming weird today. I wish I had had that. I think the other thing that was really critical to me was whatever role I've played, whether it was directly in clinical care or in more of a strategic business space, I will always have a heart for underserved communities, some of the folks that sometimes get left behind in the healthcare space. And part of the mission and vision for House Call the App in the future and overall is to make something that is accessible to everyone, not just something for the elite or for the folks that can, afford it or who have disposable income, because there's need that goes well outside of that group. So when we combined the opportunity to work with phenomenal women, right, with work that I admire and have respect for, it was a pretty easy yes.